Hello friends, welcome to a new chapter today. In this chapter we are going to learn about the genetic predisposition to cancer. So in this genetic predisposition to cancer, first we will have to learn about autosomal the dominant cancer syndromes. All the cancers which will predispose to autosomal dominant inheritance, that these include, here only one inheritance of one gene is sufficient for causing cancer. So these include, we have von Hippel-Lindau's syndrome, that include renal cell carcinoma, retinoblastoma, Cowden syndrome, that is P10 gene, NF1 and 2 gene. Then we have nevoid basal cell carcinoma syndrome, melanoma, MEN1 and 2, HNPCC, hereditary non-polyposis colonic cancer syndrome, Li-Fraumeni syndrome, familial adenomatous polyposis, LKB1 gene in Peutz-Jeghers syndrome, ovarian and breast tumor. So all these are associated with autosomal dominant cancer syndrome. Then what about the familial cancer syndrome? See, familial cancer syndrome most commonly occurs in families. Okay, it occurs in families. There is no clear defined pattern of inheritance or transmission. It most commonly occurs at early age of onset, especially two or more relatives in a family might be suffering from familial cancer. Examples of familial cancer include cancer of colon, ovary, breast and pancreas. These include cancer of colon, ovary, breast and pancreas. Then we also have one more type of cancers, which is autosomal recessive cancer syndromes. These autosomal recessive cancer syndromes is due to defective DNA repair. Defective DNA repair will result in this autosomal recessive cancer syndrome. In this we have these syndromes, which include Bloom syndrome, Fanconi syndrome, ataxia telangiectasia and xeroderma pigmentosa. So autosomal recessive cancer syndrome, due to defective DNA synthesis we see Bloom syndrome, Fanconi's anemia, ataxia telangiectasia and xeroderma pigmentosa are seen in autosomal recessive cancer syndromes. So now, what are the fundamental changes that occur in cell physiology that determine the malignant phenotype? When do you see that there is malignant phenotype? Okay, so what are the changes in cell physiology that together determine the malignant phenotype? These changes include, we have oncogene activation, that is self-sufficiency in growth signal. Then we have insensitivity to growth inhibitory signal, evasion of apoptosis. So main changes in cell physiology are, there will be oncogene activation, there will be insensitivity to growth inhibiting signal, there will be evasion to apoptosis. 1 minute. See, what are the features that you see is, first oncogene activation will be there. Because of oncogene activation there is increased tumor cells. Okay, then there will be insensitivity to growth inhibiting factors. Okay, then after oncogene activation we can say that there is insensitivity to growth inhibiting signals. Okay, then there will be evasion of apoptosis, that is apoptosis will not occur properly. Then there will be limitless replicating potential is present. There will be limitless replicative potential, where the cells undergo replication for an unlimited time. Then it is associated with angiogenesis. Okay, it is associated with metastasis also. There will be DNA repair defects will be there, and the cancer cells will also have a type of glycolysis which is called as Warburg effect, or we also call it as aerobic glycolysis. In cancer cells there is Warburg effect or aerobic glycolysis is also seen in cancer cells. Okay, in Warburg effect or aerobic glycolysis, glucose metabolism, normal glucose metabolism in mitochondria, that has been changed to glycolysis in cancer cells. Why is it changed to glycolysis? Because in tumor cells we require increased glucose requirement is present in tumor cells. So because of glycolysis there is increased glucose requirements in tumor cells is seen. So this glucose metabolism disturbances is mainly used in its identification with the help of PET scanning. That is, in this we use 18-fluorodeoxyglucose, and this glucose is uptaken by the cancer cells, and thus we can find the cancer cells. Okay, so this is about the fundamental changes in cell physiology. So this is about the main thing about the cell division, cell disorder. In the next class we will learn about cell cycle and control mechanisms. Thank you for watching my lecture. Thank you.